I'm Dr. Mudit Khanna, Consultant Orthopedic Joint Replacement Surgeon at the South Mumbai unit of Wockhardt Hospitals. Now today we are going to be speaking about what really Computer Assisted Orthopedic Surgery or CAOS really means. Now orthopedic surgery, especially knee replacement surgery, can be performed through a traditional or a conventional technique, or it can be performed with the help of computer assistance or computer navigation. Now, the objective of today's talk is to explain how computer assistance can help in performing a knee replacement surgery better than the traditional technique. So, before we go on to discuss what a computer assisted surgery is, let us understand what the objectives of a knee replacement surgery really are. So, for the patient, the primary objective is to be pain-free. But from a surgeon's perspective, the primary objective of a knee replacement surgery is to restore the normal alignment of the limb. This essentially means that majority of patients who end up coming to us for a knee replacement surgery have their knees bent in one way or the other. So, some patients have their knees more as bow legs or varus knees, while the other patients have knock knees or valgus knees. So, when we perform this surgery, we want to be sure that we can restore the normal alignment of the limb, which means we want to be able to get the limb back straight to neutral. Also, what we want to achieve is that the knee is stable through its entire range of motion. So, when a patient bends the knee and when the patient straightens the knee needs to be completely stable throughout its range of motion. So, coming back to a traditional method or a conventional method of performing a knee replacement surgery. So, in a conventional method, when we perform the surgery, we primarily rely on the surgeon's vision and a surgeon's judgment to achieve this proper alignment and balance. In a computer assisted surgery, however, we create a 3D model of the patient's knee on a computer, and then as we perform every step of the surgery, we verify whether we have achieved our objective or not by looking at the computer screen. So, even if we have a minor error of, let's say, 1 degrees or 2 degrees in being able to correct the alignment, we are able to spot it because the computer shows us whether we are correct or slightly off where we want to really be. Also, when we take the knee through its range of motion, the computer shows us whether we are well balanced, whether the knee is stable as we take it through its range of motion or not. So, undoubtedly, the fact that if we have an assistance from the computer which can show us whether every step of the surgery that we have performed is correct or slightly abnormal, then that feedback from the computer helps us to perform the surgery better. Now, if you look at what studies have shown so far, multiple studies have shown that the restoration of alignment using a computer assisted surgery is far superior to restoration of alignment when a traditional technique or a conventional technique is used. Also, more recent studies and more recent publications have shown that the longevity of the implant or the need of revision, which means doing a surgery again, is prolonged in patients who underwent knee replacement surgery utilizing computer assistance versus patients who underwent the surgery utilizing a traditional or a more conventional technique. So, if you feel that you would like to consider a computer assisted knee replacement surgery, please don't hesitate to come and meet us so we can discuss this out more at length and we can explain to you how computer assisted technology may help giving a better functional outcome and a longer lasting implant for your knee replacement surgery. Thank you. you.